Hey everyone, welcome to this explainer. Today, we're embarking on a genuinely fascinating journey to uncover exactly how a 3,000-year-old spiritual practice, originally developed in ancient India, transformed into a scientifically validated clinical intervention. We are taking yoga completely out of the studio and putting it under a biological microscope.
So, here's our roadmap for today. We're going to trace the ancient philosophical roots, dive deep into the physiology and that crucial HPA axis, look at the hard clinical evidence, and finish up with how this fits into modern integrated healthcare. Okay, let's dive into this.
All right, Section 1, Ancient Roots, Modern Science. We've got to start with the philosophical foundation. Historically, yoga developed right alongside the philosophical traditions of ancient India, and it really evolved as a comprehensive lifestyle system meant to promote harmony between the body and mind. To really wrap our heads around this, we have to look back to classical texts, specifically the Yoga Sutras of Patanjali. He basically nailed down the definition over 2 millennia ago, writing, "Yoga is the calming, regulation, or cessation of the fluctuations of the mind." What's wild here is that early yoga wasn't really about twisting yourself into a pretzel. It was primarily a method for cultivating intense mental discipline and contemplative practice.
Think about how this ancient framework naturally builds outward. It starts with internal emotional awareness and self-control, and then literally ripples out into empathy, compassion, and even conflict resolution. These deep psychological dimensions form the absolute bedrock of yoga's benefits, laying the groundwork for the physical and biological changes we're about to explore. Moving right along to Section 2, the physiology of yoga. This is where things get really cool, because we're translating those ancient philosophical goals into measurable, modern biological science.
When you compare classical yoga, with its heavy focus on mental discipline, ethical principles, and breathwork, to modern therapeutic yoga, the shift in perspective is pretty incredible. Today, we view it as a highly structured clinical intervention. We finally have the biomedical vocabulary to validate what those ancient practitioners were doing. When a yogi thousands of years ago focused on breath regulation, modern science now looks at that and says, that's actually targeted autonomic nervous system regulation. So, the real MVP here is the autonomic nervous system. Think of this system as the main biological bridge between psychological stress in your brain and physical disease in your body. It's constantly regulating the heavy hitters, your heart rate, your blood pressure, your inflammation levels. By shifting the body into parasympathetic dominance, that rest and digest state, yogic breath control actively bridges the gap between a calm mind and real, measurable biological stress reduction.
Section 3, Rebalancing the HPA Axis. Let's get into the cellular response and look at the deep mechanics of how yoga fundamentally alters our internal chemistry.
All of this begs a pretty massive question. How does yoga actually fight disease? Are we just stretching and feeling a bit more relaxed, or is there an active battle against pathology happening right down at the cellular level? Well, let's look at the exact inflammatory markers yoga targets. It actively drives down inflammatory cytokines, things like IL-6, TNF-alpha, and C-reactive protein. And that is huge, because these are the exact same markers that fuel chronic diseases, like cardiovascular issues and autoimmune conditions. While it's driving those down, it is simultaneously boosting protective antioxidants like superoxide dismutase. It's a remarkably powerful anti-inflammatory intervention.
Let's break down the exact biological chain reaction happening in the hypothalamic pituitary adrenal, or HPA, axis. Step 1. You experience psychological stress and the HPA axis fires up. Step 2. Cortisol and a cascade of stress hormones flood your system. Step 3. Yoga steps in. Through controlled breathing and movement, it triggers parasympathetic activation. And finally, Step 4. Cortisol levels drop and your body returns to homeostasis. Why this matters? Well, this exact HPA axis regulation is the underlying reason yoga helps you sleep so much better, dulls chronic pain, and literally mitigates the biological wear and tear of everyday stress.
All right, on to Section 4, Clinical Benefits and Evidence. We've talked about the cellular mechanics, but let's see what the hard data actually says across thousands of scientific publications.
Get this, 70 to 80%. That is the amount of tidal ventilation handled purely by your diaphragm during quiet breathing. I absolutely love this fact because it perfectly illustrates why yogic respiratory retraining, or pranayama, is so profoundly effective physically. By actively retraining the diaphragm, yoga drastically improves respiratory mechanical efficiency. It's an absolute game changer for patients managing asthma, COPD, and even cardiovascular conditions.
And the evidence extends way, way beyond the lungs. Over recent decades, yoga has become one of the most extensively researched complementary health interventions out there. Structured programs have been clinically proven to improve an exceptionally broad spectrum of health outcomes. We're not just talking about obvious stuff like flexibility, balance, and muscular strength. We are talking major clinical domains: cardiovascular health, metabolic regulation, like literally lowering HbA1c and diabetes, chronic musculoskeletal pain, anxiety, depression, and overall sleep quality. Now, caveat here, we do have to note that the exact magnitude of these benefits varies. It depends heavily on the specific condition being studied, the style and intensity of the yoga, the individual participant characteristics, and of course, study quality. But the overall, consistent direction of benefit, it's undeniable.
What's fascinating is how incredibly precise this data is becoming. For example, research now highlights how yoga influences neuroplasticity and cognitive function totally differently across genders and life stages, like mitigating cognitive decline during andropause or actually amplifying neuroplasticity via estrogen in reproductive age females. And when we zoom out and look at this within the broader context of traditional Ayurvedic medicine, we realize these precise biological responses have always been part of a holistic, whole-system lifestyle approach to managing chronic disease.
Which brings us to Section 5, Integrated Healthcare Application. How exactly are these proven benefits applied safely in modern medical systems? In a modern integrated healthcare setting, yoga isn't sitting out on the fringe. It's situated right alongside conventional Western medicine, nutritional medicine, and mind-body interventions. The absolute key here is that yoga should be viewed as a structured physical and behavioral intervention that complements conventional medical management. It is a therapeutic partner, definitely not some alternative to modern medicine.
Let's move to and see how this builds into a real-world clinical pathway. It always starts with step 1, a solid, conventional medical diagnosis. Step 2 is a risk-stratified referral. This is crucial. We have to recognize contraindications, like screening out severe uncontrolled hypertension or acute fractures. Step 3 involves modified yoga therapy, which must be led by a qualified instructor who adapts the program specifically to the individual's needs. And finally, step 4 ensures shared decision-making and consent between the doctor and patient.
So if there's one core takeaway I want you to remember today, it's this. Yoga is an outcomes-driven extension of patient care. Look, modern medicine is incredible at keeping us alive and managing acute crises. But let's be honest, many patients are left dealing with a massive residual burden of chronic disease, stuff like lingering fatigue, anxiety, persistent pain, and sleep disturbance. Yoga steps in precisely at this gap. By combining biomechanics, breath, and mental focus, it improves daily functioning and actively resolves that residual burden.
Before we wrap up, I want to leave you with a slightly provocative thought. We know that predictive AI and wearable technologies are now constantly tracking our sleep, our heart rate, and metabolic deterioration to establish our unique baseline of health. As these AI systems start flagging early imbalances years before a chronic disease actually sets in, will highly personalized, data-driven yoga routines become a standard proactive medical prescription for everyone? I mean, the fusion of ancient wisdom and predictive technology might literally be the future of global healthcare. Thanks so much for joining me on this explainer, and keep learning.